at ya, at ya. Tell you what's master, coming at ya, coming at ya. Rhyme style disaster, coming at ya, at ya. Tell you what's master.
All right, welcome to the Cut the Bull podcast. This is Wilfred Reilly here with co-host Christy Kelly, Brooks Crenshaw, and our guest today, Pat Lockwood, who is, as I understand, psychiatrist, right? Not psychologist?
Psychologist.
Psychologist, okay, yeah, I've always gotten those confused. And a therapist, pretty well known in that field. We've interacted on X and so on. And we asked him to come on this show to discuss some of the questions I think a lot of people really have in the American upper middle class. Does therapy work? Does it work for men? Or if it does, are we over prescribing some of these remedies, SSRIs and so on, even talk therapy? How should therapy work? So, Pat, to open up with the first question, I guess, does therapy work?
Well, I guess you'd have to describe what you mean by the word work.
Okay, that's actually an excellent question methodologically. I mean, I think that the basis for the question would be, I've looked at studies of the impact of various therapeutic methodologies on men in particular over the years.
Yeah, sure.
And my understanding is that it's 44.8% of them, I think, say there's basically a negative effect. They drop out quite rapidly. Others, it's about 50-50 positive or neutral. And that seems to compare, and obviously you understand that at the upper end, there probably is something positive happen, right? But that seems to compare pretty much equally to, say, running or having more sex in your marriage or like boxing. So what's the framework there? When does therapy work? Why does it seem to not work much of the time?
Yeah, I think there's a number of questions we have to still ask when we're talking about the concept of work, because if you look at a lot of randomized controlled trials that are done with psychotherapy or psychotherapy plus a medication, a lot of their therapeutic endpoints in these studies include something like, some random score reduction on a screener like a PHQ-9 or other standardized measures. And so does therapy work, does it provide symptom relief per these standardized screeners, then you would see a lot of research that says it's generally very effective, more effective than even running or sex or something of that nature. But then the bigger, broader question is, if therapy working means you have a foundational or drastic change in the way you function in the world, which is just different than decreased depression symptoms, decreased anxiety symptoms, then I bet it's much closer to 50%. Because the problem with therapy working from the big picture perspective is the question becomes, is that person actually taking these lessons they're learning in therapy about coping skills or some insight or whatever it is and taking it out to the real world, right? Because learning how to cope in therapy is not super complicated. I can teach most people how to cope with anxiety, etc., very quickly in 3 to 4 sessions. In fact, there's a lot of research that says you can do brief therapy and get some substantial, even lasting relief from people, especially if they have a more mild version of like an anxiety disorder or whatever it is. So the real question is, for the people that are perhaps maybe sicker, people with more severe versions of illness, is it going to actually do a whole lot compared to people who are more well? But then the question is, are we comparing the worried well to people with a mild version of an illness to people with a severe version of an illness, right? And so it depends upon what group of people you're talking about. And I say none of that to kind of excuse bad therapists, because there's tons and tons. I have an entire podcast literally dedicated to how terrible the profession is. So you're speaking to the right guy who is very critical, if that makes sense. So I'm all about not wasting people's time and money. The people that we would call the worried well, the people who like think they're sick, but they're actually not, should never go to therapy. They might get something out of it, but it's not really the best use of their time and money, if that difference makes sense. But people with milder and moderate versions of an illness, they probably would get something out of therapy. There's a bunch of things you can do that might make therapy less necessary to some degree. So really the question is, what group of people for what diagnoses or issues, and how severe is the version of those issues? How many co-occurring disorders? How long has the illness lasted? How much like their SES, their social support, all these things. So there's all these variables you have to pick apart. You can't just say does it or doesn't work, if that makes sense.
Yeah, I mean, I think unless I was intentionally trying to be an asshole, just something I would never do, I don't think that anyone would deny that if you sent someone who had a moderately serious mental problem to a good mental health practitioner for 4 sessions, they would probably get better. I mean,
Sure.
you know, I've had people tell me very basic things in life, like don't get in fights with people and your life will improve. And I would suppose that that's probably, uh, I suspect all the males on the panel may have heard that actually, but that's obviously that sort of thing is useful.
Yeah.
But it's one of the things that you said sticks out, where you said that a lot of the people that are involved in kind of therapy culture in the USA,
Uh-huh.
I think the
Uh-huh.
term was worried well. There are
Uh-huh.
people who may have minor relationship or mental health issues. These are things that really a book or a martial art or something else could help you with. They seem to be, from my experience dating women in that social class, often in therapy for 10 or 20 years.
Oof.
What, how does that happen? And how does that happen and what's the effect of it, I guess? And if you can speculate, what percentage of people actually need mental health medical care, basically?
So the second question about what percent need actual medical care, right? So we have some data that can speak to that. So I'll get to that in a second, but because that's the easier one to answer. But the one that's more speculation, which is the worried well, and why are they there for 5 years or 10 years or 20 years or whatever it is? So the people that many of us would describe as the worried well, just to be clear about what that means, at least from my perspective as a professional, it would be the people who have understandable, typical life stressors that are difficult to manage, but they have skills and resources to manage them. However, they're having a hard time using those skills and resources to manage those typical life stressors. So it could be relationship issues, job issues, burnout, whatever. So normal, understandable, typical, predictable things. And so because they're maybe a little uninsightful or less intelligent or less adequate at utilizing their social resources, their family and their friends to get their needs met, they might think they should go to therapy because they're going to go learn something somewhat deep or profound or have a new relationship with themselves that will motivate them to live some kind of optimized life, like you see in like the guru sphere and the influencer sphere online. And so there's nothing wrong with wanting a more optimized life, but this idea that you can like cold plunge your way to being super productive and happy or some shit like that is just, and I'm a guy who is part owner in a business like that, so I'm not trying to knock it, but like it's not going to make you the next Fortune 500 CEO or something. You're not going to be super happy and profound because of it. So the worried well probably see that there's some deeper insight or believe at least whether or not it's mistaken that there's some deeper insight about themselves or the nature of existence in like the Buddhist sense or something that they're going to get from therapy by having this. I mean, at the point at which you're a worried well person going to therapy, you're probably treating that therapist less like a medical professional and more like a pastoral counselor or spiritual counselor or even like a spiritual teacher or a guru of some kind. And so that's not really therapy. You're paying for a fancy life coach with a degree or a spiritual counselor. And so I think there's better solutions for that kind of person that are more adaptive, cheaper, more holistic in the sense that you're part of a broader spiritual community, maybe in one example. Again, I go back to that because it's like the lowest hanging fruit example. So for me, I think the worried well are looking for some expertise because they think expertise is where meaning will be found to some degree, but also they're probably just very naive about what the industry is. And there are professionals who don't know any better, unfortunately, because they weren't taught better. Right. So as a professor in graduate psychology, that bugs the shit out of me, right? That you're treating people who don't really need you. Right. So when I teach my master's and doctorate level students, we're talking about how to refer people out or get them to the appropriate support systems that they need to be a part of. But then the other question you had was about the people who are seriously mentally ill or they have persistent mental illness, right? And so that's a relatively small segment of the population. So at any given time, people might be diagnosed with PTSD, probably max of like 5 or 6% of the population. That's a VA statistic. And so that's not a large group of people, but it's also not a small group of people. So if we just take PTSD, the diagnosis, we're looking at potentially, maybe in the United States, 10 to 15 million people, maybe 20 million people, if we were like very liberal with the boundaries of what is PTSD. Okay, so that's not a small group of people, but does that mean there's a lot of people walking around with PTSD all day? No, not whatsoever. Same thing with schizophrenia, like real schizophrenia, like very, like not temporary schizophrenia from drugs or trauma or something of that nature, is pretty rare. Maybe 3-ish% of the population, maybe. So that's about 3 million people that have very serious, hard to treat, hard to manage schizophrenia, right? And same thing with substance use disorders. About 6 to 8% of the population has a substance use disorder. I think if I look at the SAMHSA statistics, if I have it right in my brain. So, but of that group of people, the vast majority are mild or moderate diagnostically, which means that they probably don't need to go get locked away in some fancy rehab like the places I used to run. They probably need to go, exercise, good therapy, all the things, but not go lock away and spend 10 grand a month or 30 grand a month or whatever it is. So the more severe end of the spectrum is probably about 1% of the population when it comes to a substance use disorder. So upwards of 10% might have a substance use disorder, but most that's mild or moderate. The severe end is about roughly 10% of that. So, the severe end is probably, again, 5 or 10 million people maximum, right? Even though there might be 30 or 40 million people with a substance use disorder. So you're looking at maybe just me randomly throwing numbers together, kind of off the top of my head, not having anything right in front of me. You're probably looking at maybe 30 to 40 billion people who need a lot of medical care, in addition to psychological care for their serious mental health problem, which is, that's 10% of the population. So that's a lot of people, but that doesn't mean that everyone needs the same intensity of medical care. So some people need to go to a residential and get stabilized, or a psych hospital. Some people need to go to therapy 2 or 3 times a week and do like an intensive outpatient program. Some people need to do therapy just a couple of times a week and see a psychiatrist once a week. And so there's a diversity of severity of symptoms that require diversity of severity of services, which is why there's this thing called the ASAN criteria, which has different levels of care that step you up or down depending upon impairment and functioning and things like that. So that's just my rough off the cuff take.
Yeah, no, thanks for that. I will say one thing kind of quickly as a cynic. I would say that a lot of these estimates from the medical organizations for some of these conditions seem a little bit high. So, like in the political science literature, schizophrenia is, and Pat's numbers are real, but schizophrenia is generally thought to affect 1 in 300 people, which would be in the USA, I mean, about 1 million people max. So that 10% figure is probably, it's reasonable. It's definitely in the debate. But I mean, like 50% of Americans or something like that go to therapy at least semi-regularly, as I understand. But no, thank you for presenting the data there. Both of you guys, Brooks and Christy, have been nodding quite patiently while I've been asking these lengthy questions. He's been responding to them. So, Christy Kelly, what's your thought here? You've mentioned using therapy yourself, getting some benefits. What's your take on what's been said so far, or anything else you want to bring to the field?
Yeah, well, I think one thing you said was that therapists don't know any better. I think it's probably more insidious than that. I mean, I think
Okay.
if you bring people in for therapy and it's supposed to be short term, then it's kind of job security, right? If you're more using it as, okay, tell me about your problems. And then you're sitting there for 50 minutes and you're listening and you're barely saying anything and you're not really moving them towards solutions. And then, okay, see you next week, So it's like, I think it's probably a little bit more insidious. I did have a question for you, though. I'm really interested to ask you. So
yeah,
I think there's a stat out there that says and about 1 of 8 kids are, depressed or, ranking as being depressed. It's extremely high, whatever statistic you want to use. How much of that, in your expert opinion, is manufactured? Is it true? Is it not? I'll give you my opinion. I mean, as a mom of, young adults and teenagers, I mean, I really think it has more to do with what they're watching with TikTok, with, first of all, they're inundated with all the social media stuff. And then what is social media saying? It's, it's body shaming, or it's saying that you should be depressed or you should be worried. So how much of that stat is actually true, like in your professional opinion?
I mean, it's really hard to say because a lot of these statistics come from, like Wilfred said, like they come from these federally funded programs like SAMHSA or the National Institute of Mental Health. And so you have to look at the quality of the methods that they use. And so one of the things I'm less fond of with the SAMHSA data in particular is they use these screeners that aren't super thorough to determine if you've had a major depressive episode in the last year. So SAMHSA does this national survey every year and looking at young people and substance use and mental health. And they use some pretty flimsy screeners to look at whether or not you've experienced a major depressive episode in the past year. And so the rates are higher because of the types of screeners that they use. Another one of the confounds in the literature is, this is one of the, I don't have the study author off the top of my head. I'll try and find it and send it to you if I can remember. But the more times you've been given a screener by somebody, a therapist, a psychiatrist, an assessor from SAMHSA, whatever, the more likely you are to be diagnosed, which should make zero sense because either you have the symptoms or you don't, right? So I would say that 1 in 8 is probably pretty high, but it also depends upon what we're really defining as depression. If you're saying a kid had a major depressive episode, that wouldn't shock me too much because in adolescence, you're more likely to go through a variety of stressors that might give you an episode. But an episode is not a diagnosis, right? So major depressive disorder is not the same thing as having a major depressive episode, right? Likewise, having experienced a trauma, something like 80-something% of the population will experience trauma in their lifetime, but only like 3 to 6% develop PTSD. So it's extremely rare to actually have PTSD, but it's not weird to experience a trauma while you're alive. So I would be shocked if a lot of kids had had a major depressive episode and then found their way out of it through family, social support, sports, whatever, or maybe just had like what we call subclinical or prodromal symptoms of depression, where it's like they have a couple of symptoms that are real, but they're manageable. That doesn't mean their life quality is great, but they're manageable, right? So I like to be very specific, and to the extent that the data is good about that, it's not super specific, unfortunately. So people are left at the level of like super broad discussions, which I think it kind of makes it easier to punch the profession. And fair enough, honestly, in my opinion.
Interesting. One thing, and I'm going to pass the ball back to Christy on this question, but one thing, Christy, it seemed like you were mentioning is just the impact of finance. And I don't want to single out the therapists on this, but on most professions, like I'm a lawyer by background. Yeah. And I'll tell you, in the USA, we've got a, what is it? One of you guys might correct me, at 40% of the world's lawyers. And I noticed that we have a large number of lawsuits that people in most other countries might resolve with an argument or a beer. I mean, I've been sued for things I've said online, actually, not very seriously. But you understand it's the same thing. Now, Patrick, as I understand, you have a side business. You're doing pretty well. But like, if you are doing kind of bog standard therapy, where many of your clients are basically sane business women in Manhattan or Chicago, and most of them have been going for 2 or 3 years, or you're pretty friendly with them, are you ever going to tell them that they're cured? I mean, Christy, is that kind of what you're saying?
I mean, that's kind of been my experience. I mean, instead of it being going in knowing, okay, I'm going to have 4 or 5 sessions, and then I'm going to move to solutions, and then I'm going to have coping, mechanisms. What I've seen, even in my own life, I mean, I have, one child that has autism. And so, we've been in therapy for years. So she's maybe excluded, but, my kids also, their natural father, he passed away. So of course I had him in therapy, at an appropriate age. But at what point do we move from, I mean, as mom, I had to be like, okay, enough is enough. You know what I mean? Like it's time for us to learn coping mechanisms on our own. And we just pretty much just had to say no more therapy, because the kids start treating like the therapist as like their friend almost, or their number one outlet. And the same with adults, right? I mean, you saw it like on Sex and the City and stuff. Like it became trendy to actually go to the therapist and sit on the couch and,
it's confession.
Yeah,
Yeah.
rather than actually. I do think there is a financial benefit that therapists use.
No doubt. And I would say there's a spectrum of people who are more or less aware of how they're participating in that dynamic to essentially convince the patient to stay with them. So I would say that there's a segment of people who are very blissfully unaware that they're doing that, and they are very good at rationalizing what they're doing. And they can even point to things that the patient has said and done, how the patient's struggling to use a technical word, individuate and go live their own life, right? And so I think, like, I'm just going to randomly split it up into three groups of people. I don't know if this is true. I don't know of like a paper that supports this. Is just my off the cuff response. So I'd say there's a group of people, one group of people of three who is unaware that they're doing that. They are unconsciously participating in the person staying stuck and not individuating and living the best possible life for themselves. I'd say there's a second group of people who are very narcissistically organized, who believe that they are so smart and so special that they have to help people. And so that's the category of people that I consider somewhat mentally ill who don't know it. And they are in the class of gurus who are not intentionally maliciously doing this behavior, but it's still unethical and malicious and not helping people, if that makes sense. And then I guess the third group of people are the people who are newer to the profession and have some ethics and are willing to see people as long as is needed, and then they go about their way. So I don't know what percentage of the profession lives in each bucket that I've just described. I would be willing to say there's a larger group of people in bucket one, probably 30%, just randomly throwing out a number based upon my experience here in SoCal and people I know across the country. I would say there's thankfully, my experience at least, there's a smaller percentage of people in the second bucket, the malicious narcissists who are the gurus who are going to help you forever, etc.
Dark triad types.
Dark triad types, or, people who just think they're special, or whatever. And I think those are the probably 10 to 20% of the profession maximum in my estimate, based upon the convenient sample of people I know in the profession. And I'd say then the rest, probably, if I'm doing the math correctly, about 50 or so percent of people will probably not see you forever. They'll see you for a year, maybe 2 years, maybe if you want to come back for a touch up, whatever it is, or etc. So I would be shocked if the majority are the malicious type. That would be surprising to me, because I know so many people in so many states. Most people don't want to see you forever. Insurance won't pay for it if it's insurance based, etc. So there's a lot of obstacles to doing the forever therapy kind of thing. There's also just not that many worried well that seek out therapy, in my opinion.
So I'm interested in something you said, like, why did you qualify bucket 3 with new to the profession?
Because my experience, my very biased experience, teaching at the graduate level for about 8 years, and then, being in the profession for 15 years, what I've noticed is that newer people who have at least some decent training and some decent mentorship will be like, oh yeah, this person's fine. I don't need, I can get new referrals, right? Because if you're doing the business correctly, actually, what you want is a stream of consistent referrals. You don't want the same 10 people forever and charge them an arm and a leg. You want new people that you can help and move on and go on. So it's actually good for business, because you're going to refer people out, you're going to get new referrals and meet new people at continuing education events. And so there's kind of normal social pressures and business pressures to actually see new people, as opposed to just seeing the same people.
Yeah. And I mean, I think that there's a lot of shitting on new people in any profession, but in my experience, I've generally found them to be better and more ethical because bad habits haven't set in over a great length of time.
Mm-hmm.
But Brooks Crenshaw, we've all done a fair amount of commentating on this panel so far. It looked like you had a number of questions ready to go there. What's next up for Pat here?
Well, yeah. So Pat, I'll give you some of my observations from my background, and maybe we can just talk about that.
Yeah.
I'm a veteran, did 10 years, did 4 tours back to back to back. deployments. And my transition was very difficult, and that's a very
Yeah.
common thing. I was in a naval special warfare unit. I was an intel guy. And
Yeah.
so like my job was to provide the proper information that most of the deaths that we experienced at the teams were in some form or fashion an intelligence failure. So my job was a very high pressure job, but it was,
Yeah.
you know, in the sense that we're pack animals meant to carry weight, you know, it was
Yeah.
the biggest weight I could imagine carrying. And then suddenly I'm a college student and nothing I could do possibly could matter. And to go from heavyweight to no purpose, it's almost as if, you know, I'd been placed on a scale and you hit the tear button and then take the weight off the scale and it's just negative. You're floating around and there's no purpose.
Yeah.
So in that like 2-year time frame, you know, I went to the VA, got my, you know, all the diagnoses that they put me through, panels and boards and pricks and jabs and what have you. And you know, that 2 years was very rough, and I was in therapy most of it. What I came to find was I think I would have been better off with, you know, maybe a box breathing and some potential exposure therapy with regard to hypervigilance. But after that, it really just became, I was the central focus of myself. Right.
Yeah.
So like when you think about yourself, like it kind of led me down a particular spiral. And, you know, kind of the way I found myself out of that was, you know, a buddy of mine had gotten out as well. And we were both graduating university. And now you've got this new end of the road that you have to traverse, and you don't know necessarily what's on the other side of that. And you've already come from this high purpose, you know, high weight experience. And so, you know, that was weighing on both of us. And we knew from combat and from training that when you're having a hard time, you look around and find somebody to help. So we organized a charitable event, and I met my wife there, and that was a really good experience. And we've been married for 11 years, and, you know, that's been a really good thing for me. But like those 2 years, I was in therapy constantly. And I think that had I just gotten some good information and strategies on how to overcome some of the larger symptoms, and my symptoms weren't that, you know, a lot of guys came out, I didn't get my legs blown off, right? My biggest trauma was losing some of my closest friends, more than anything else. But in that 2 years, I was constantly thinking about myself, and I was miserable. Is there anything to the notion that consistently just being hyper focused on you is a counterproductive way of being?
Yeah, I think being hyper focused on you is terrible for pretty much anybody. I can't imagine whether it's in therapy or out of therapy or whatever. I mean, there's something to looking at yourself from time to time or a couple of times a day and making sure you're not violating your principles or violating your morals or violating your expectations for what you have to do that day. That all makes sense to me. But you know, always worrying about how you're doing is terrible for everyone. That's basically generalized anxiety disorder in a nutshell, and I wouldn't encourage that to anybody. So I think my hope for everyone who, whatever the diagnosis, but especially diagnoses like PTSD, you know, there's zero literature that says stare at yourself all day and then have zero relationships or don't do anything meaningful in your life. In fact, like one of the earliest studies on PTSD was the one from Vietnam veterans, right? That's the famously cited one where it's like, there's two groups of people who came back from Vietnam. There's the group of people who did a bunch of drugs and had a bunch of trauma and came back to a family, to a job, to life, to community, and they didn't end up becoming drug addicts. Interestingly enough, they used a bunch of heroin over at Vietnam and somehow didn't end up here struggling with addiction. But then there's the group, and it's not perfectly separate, but like then there's a group of people who went over to fight in Vietnam and they came back and they were shunned by society, shunned by their family and friends, had no wife, spouse, whatever, and they were miserable. And they had no community, they had no job, they had no purpose, and so they ended up using a lot of heroin. Now, again, that's me oversimplifying the studies, but like
this is the mice and the cocaine, right? in the sense that
Rat
You're
Park,
talking about the
yeah.
study where like that, just for the audience, you're talking about the study where like mice that had room to play in water and so on.
Yeah,
People
yeah,
that
Rat
generally
Park.
just
a
do that.
communal area.
Yeah,
Yeah, but if
yeah.
you
I
just
mean,
put mice in like a dark cage with a button that releases drugs, all they do is eat their own young and take drugs.
yeah, yeah. I mean, Rat Park hasn't been replicated yet. I don't think it will replicate, but the idea behind it is 100% correct, which is there's no mammal that's an asocial species, right? And so it makes literally no sense to try and treat somebody in isolation and then just send them back out in the real world and encourage them to not practice being with people and having a new relationship with the world around them. That's actually the whole point of therapy. The whole point of therapy is not to stare at yourself. It's to stare at yourself and go do something different out there. So every time I've run a rehab, or even I had a couple brief stints doing private practice, I've never told my patients to just go home and meditate and be fine by themselves. I'm always like, how are you going to go take this and go do something out there with people? Are you going to get a different job? Are you going to keep your job, but then interact with people differently? What are you going to go do? And maybe it's because I'm a dude or something, but like, I think we should be going and doing something. Thinking is
Yeah,
great, but like,
if I could jump in there just to shout that out, because I think it's actually a really important point, and it may actually be because you are a man and you seem to be a normal guy offhand, but the idea of developing and improving the self to some extent has to be for a reason. And Brooks, Christy, you guys could disagree with this, but like you can't just say I am great. Great is a relative competitive thing. So what you're saying is, at least as I understand it, is you need to resolve these problems you have so that you can get back out into the money earning, the dating, the athletic, the military market and compete with other people that also think they're great. And if actually you end up losing every single time you do that and people view you as a sociopath, you're probably not all that normal. So, I mean, I think that's important to note. Like, not the patient is not generally right. Now, like, if you're in a lawyer's office, you're there because you're charged with a serious crime. And I would assume that's quite similar in your field.
yeah, for just real quick, my hope for people is that their healing can happen with me. It's in my professionals, the kids that supervise, whatever. But like, you don't just heal in the therapy office. You heal by going out and having a new experience with the world. It's like psychedelics, right? So like, I'm a fan. If you take LSD, or can you tell? But like, if you take these substances, the goal is not to sit in your room and jerk off and do LSD. The goal is to have but like the goal is to like have the trip and then go do the integration phase of the psychedelic experience. So like you have the cool trip or whatever, but then you go do something with this insight you just learned. You literally don't just like sit there and figure it out and you're done. Right?
So-
Yeah,
Like,
actually, that's the biggest predictor of a bad trip. Like you're sitting
Right.
alone in your family home or in the dark corner of a rave, and that's when you have to sort of go
Right.
save people. I mean, that's
Yeah.
actually quite interesting.
So I don't know
Yeah.
anything about LSD trips, but I
That's good. Christy Kelly's a lady on this damn panel. She doesn't want to hear any more of this barbarism. Sorry, go on, Christy.
but I would push back on it's the because I'm a guy, I moved to the action phase. Like I would push back heavily on that.
Okay, fair enough.
Because I would say one of my very first therapists, and yeah, I'm kind of outing myself here, but one of my very first therapists was when I was in college. So I was a
Okay.
teen mom. I had my first child in high school, and then I immediately went to the University of San Diego and got married at 18. And so I'm here with a husband and a baby and, a full scholarship to UCSD. And what am I doing? So I went to a therapist, like, help. And she immediately was like, your life doesn't suck. Go to class. How are you
That's
going
rad.
to manage all of the stuff that your choices got you into? Now go do that and go be great. And
Yep.
she was a woman.
Hell yeah.
Boom. No
I
one
love
hates
that.
on all the women. I will also say, as a sometime college executive, you get paid $40 for one of those campus sessions. So I
Oh,
don't want to speculate
gosh.
about them, but they might move them through a little more rapidly. But all right. I've done a lot of talking during this panel. I mean, Christy, any follow-ups to that? How your
I
experience?
actually do have another question. So we have to talk about schools.
Okay,
We have to
cool.
talk about schools because after
Yeah.
COVID,
Yeah.
parents really woke up. because the kids are at the kitchen table, they're doing their homework, the parents are hearing over their shoulder, you're learning what? And like all of this super woke, indoctrination stuff. So now there's this whole movement of like SEL and like the whole school approach. And so especially conservatives are losing their mind, and it's like, just nix all therapy. Just teach my kids math and science and just take all the therapists out. We can't afford them. I'm not sure that's the answer, is to take them all out, but I know it is risky because of all the indoctrination. So what do you think?
What do I think about indoctrination?
What do you think about school therapists, and should we just do away with them and let parents handle the therapy and just let the school handle the education?
So I think it depends, right? Because again, not to weasel out of anything, it really depends upon what the school therapist is being used for specifically, because I can see an argument, at least, where if you're trying to prevent people from dropping out, because I'm a professor, so I'm a little biased, but I'm a big fan of people completing their education. And so if there are kids who are showing obvious signs of mental illness, now the obvious piece is where it gets tricky, because like, are these professionals really well trained? Do they actually know what they're doing? I don't know a lot of good school psychologists and school therapists, so I, again, might have a little bit of a bias there. But my experience has been, if you can identify things earlier, you can save people a lot of hell later on in life. So just to name a very controversial example, let's talk about ADHD just real quick, right? Separate from the indoctrination point. So probably one of the most horrifically misunderstood illnesses by psychiatry and psychology and everyone in between is attention deficit hyperactivity disorder. And so for the people that are accurately diagnosed, who actually do genuinely benefit from a stimulant, getting on a stimulant prevents the development of a substance use disorder or an addiction later in life, and prevents them from dropping out, and prevents from like serious behavioral problems. So there's a rare subset of people who are diagnosed who actually do have a severe version of ADHD in childhood. There's a very rare subsample, probably 10% of people who are diagnosed, right? Who really are benefiting from a stimulant, who are not going to go screw up their life, right? We're not going to get into drugs because of it. That group of people probably would benefit from early identification by a therapist and maybe even some supportive counseling while they're in school. Because a good therapist can do the behavioral part of therapy for ADHD while they get the appropriate referral for meds. But other types of mental health problems, like early detection of bipolar, early detection of personality disorders, early detection of like more severely impairing conditions, would be great if it was done correctly. So for me, I can make a case for a school therapist being involved. Now, the idea that there are school therapists that are going in there indoctrinating or enfeebling kids because they're overdiagnosing them, I'm sure that happens. I have no doubt that that happens. Could some of the kids that are being enfeebled at school be taken better care of by their parents? Absolutely. I would seriously wish that more parents would take an active interest in their kids' lives and how they're developing emotionally. One of the things that I doubt is possible currently is that a lot of parents are going to pony up the time and the attention. And I don't mean to shit on parents, because I can't speak for every culture and every demographic of people, but if you're the kind of parent who has to work 2 jobs, or if both parents have to work to pay for your life, then you might not have the same emotional bandwidth left over to ask your kid how they're actually doing. So I think we have a complicated problem when it comes to kids in schools and mental health, because some parents are capable of sacrificing. Some parents are really good at sacrificing. Some parents suck at sacrificing. In fact, I'd be willing to bet there are just as many shitty parents as there are teachers and therapists. And so because there's like an average amount of mediocrity in the world, just to say it like that, I would expect that it's going to fall on the system more often than it's going to fall on the parents at home. So then what's the solution for mediocre parents? Well, it's better parents. It's better authority figures, and so we have an epidemic of shitty parents. There's a soundbite for you. And like, how do we change that culturally? Well, we have to have better role models, right? And so where do you find those better role models? Do you find them perhaps at a church, or perhaps in therapy, or perhaps at a social organization of some kind? Like, I will say, quick shout out to the Boy Scouts of America. I'm an Eagle Scout. Like, you can make whatever jokes you want about like child molestation. It does happen. It did happen a lot to a lot of people, but like, I didn't turn out the way I did on accident. There's a reason that I am a no bullshit, live by your principles person. Part of that has to do with my parents, but part of that has to do with the Boy Scouts. That's a free group you can go get some mentorship from other adults who live by principles. So you may not agree with trustworthy, kind, loyal, obedient, cheerful, thrifty, brave, clean, and reverent, and all that shit, but it certainly had a good impact on me, and it was free, and it was a place to go be around other people who are trying to live a principled life. And why isn't that more popular? Is it just the child molestation scandals, or is it because a lot of families have given up on the idea of being part of a community? I think that's happened a lot. People care too much about their phones and their money and too little about being part of a community anymore. And so for me, I think there's the school problem. There's the society has incentivized families to give up on parenting their kids to some degree because of the way schools are set up. But also I see genuine economic problems that make it hard for parents to be appropriately fully involved. But also, I think society's given up on being part of a community. I think we've got our little isolated families and our isolated tribes.
Yeah.
Which
Just
I
one
think,
quick follow-up. I think that if I had to pick a lane now, my kids are not young. I'm almost done. 2 more years, I'll be empty nester.
Yeah.
But if I had to pick a lane, I would not ever let my kids go to a school therapist. And it's matter of fact, I'm homeschooling now. So, but because I think that what we've learned is, if I'm generalizing, a lot of teachers do think that they can teach your kids. They know better than parents. Okay, your kid wants to go by a pronoun. We don't have to tell your mom because, this is a safe place. And so I think everything that we're seeing coming out of schools, I would never send because you just don't know what therapists are teaching them, what they're telling them, what direction they're going. If my child needs therapy, or you think my child needs therapy, give me a referral to an outside provider where I can go with them and sit there and be in the session with them. But yeah, for any moms watching this, I would be highly skeptical of school therapists and want to know what anybody is telling my child.
For sure. The only pushback I would have for that is, and this is again my extreme bias, is a lot of my grad students are doing their training at schools. And so it's actually a lovely place to go do training as a future therapist. And so I think it has to be balanced out with, what's the quality of the training and supervision these trainee therapists are getting, if it is a trainee therapist, and, if it's a licensed person, who's holding them accountable? Because like the Board of Psychology here in the state of California only holds you so much accountable. Really, it's up to the administrator at that school what values are being pushed or not at that school. And so, as a parent, I would imagine that, making a fuss at your local school board meeting would probably be an important thing to get in the habit of if you're trying to change the values of that school.
Yeah, and to respond there, and I'm pretty sure Christy's capable of doing that from some of the comments you made about Arizona politics and so on. But there are 2 things, Pat, that you said that stick out to me. The first, I think, is something I'm just going to mention in 30 seconds, move on. I don't see a solution. But it is that as community fades, we start turning more to the professionals in society to handle these minor disputes. I made fun of my background profession. You get a lawyer as opposed to just having an argument or going to dinner. But this is true everywhere. I mean, your estimate of the ADD diagnosis rate was 90%, a tenth of the people perhaps really have this in the sense that we all mean, that are currently taking these amphetamines in schools. And a lot of that is probably, they're not Boy Scouts, they're not playing baseball. There's not some guy who's going to lightly slap them on the head once, not that that's always endorsed, and say, come on, buck up. So you wind up in this situation where you're talking to a psychologist or a psychiatrist who's a medical professional and who's going to say, I'm going to give you this drug. And this is true across the spectrum. I mean, this is true at the police. You know, if fathers aren't in the home, if people are out in the street fist fighting, the cops are going to get involved. And the cops aren't going to have a conversation with you. They're going to take you down to the station. They're going to book you for assault one. So as community fades, pros in society are getting involved doing things that they don't really need to be because no one else is. And that's how you wind up with the stat I saw yesterday. 41% of Americans have a medically diagnosed disability. Like, no, they don't, unless you're counting inability to balance checkbooks or something. But I'm sure that there was someone willing to say that. But one thing beyond that that I would take from what Christy said, I mean, when you're talking about Christy, one of the reasons you wouldn't trust a school therapist is just straight up political bias, right?
Pretty much.
Yeah, and Pat, what are your thoughts on that? I mean, in the field of political science, we're right now, I think it's 17-1, liberal to conservative. You know, in psychology, I think you guys are a little better, but it's like 15.8-1 or something. How does that affect someone, say they're a blue collar male, they've gotten out of the military, the police force, they want to go to therapy. There's a 90% chance their therapist is going to be this doesn't even matter, but like Green Party voter who may use they, them pronouns on occasion. Like, how does that affect, one, what people are getting, and two, how much they want to do this?
Yeah, I would say it affects it moderately to drastically, depending upon the region and what school they went to. So I would say, and again, I have a very biased experience because I'm here in Southern California teaching and working for the last 14 or so years. But I'm from the Midwest and the South and know people all over the country and even all over the world. So I don't have the biggest sample in my head, but a lot of it's biased to SoCal in particular. So what I would say is most people that I've met here in SoCal are on the more liberal side. And most are not activists. So they don't speak about politics and things like that. So like I've taught at a fairly liberal school for about 8 years. And although we do talk about social justice, DEI, so on and so forth, it's not spoken about in the you have to go preach to the unconverted and convert them kind of way. We talk about it from the perspective of like, is there some drastic difference in the way people are treated in certain situations because of race, because of gender, sexuality, so on and so forth. And it's a very academic and practical discussion, right? But it's never, you have to go convince them that they're being oppressed. I know that that's what's talked about online a lot. And I'm sure in some therapy programs, it is talked about that way. But in my experience, the trainees I've worked with from different schools out here in Southern California, and my own experience teaching people and training them, is that even the most liberal of my colleagues is not pushing people to convince them they're oppressed or things like that. So I'd say that there's, again, different buckets of people, right? So it's going to be some segment is probably activist in orientation, maybe 20% or so, on the more malignant side who believe they're so special and so smart that they can see the oppression in you and things like that. And I'd say that there's probably 50+% who are well-meaning people who might be interested in these topics. And we'll talk about them as needed. And then I'd say probably maybe 5%, max 10% are on the more conservative right-wing side of things. And probably aren't intentionally pushing their values, but might unintentionally push them to some degree, or just relate to you a certain type of way that's more no bullshit, whatever it is. So that's the way I would break it down. But again, I don't know for a fact. I can't say that. It's just, I think politics shows up in everyone's therapy, usually unintentionally, and then sometimes intentionally by the more activist types. And I think that, you know, they have a lot of justifications more currently that they're using to say that what they're doing is ethical and useful. And I think the vast majority of us are probably in the silent, I mean, I'm not so silent, but there's a silent majority in the clinical world who are not like Foucault or something. You know what I mean? Most people are, you know, some normie centrist you know, even if they're kind of liberal in their orientation, like, let's talk about whatever matters and your symptoms and your trauma and stuff like that. I would be shocked if it was a majority of people being trained who's, you know, Foucault types or whatever. But there are notable examples that we see online, and that's, to me, that's really weird that you care that much and not much about their family and their relationships and their friends and their coping skills and their insight and all these things.
And I mean that's almost the religious belief on the far left. I mean, I assume there are equivalents on the Nick Fuentes right, but I mean most of the serious lefties I've debated would argue that everything you described, like a collapsing family, is caused by sexism or something like that. Women got tired of doing domestic labor, and I think this is just straight fantasy. But I've met a lot of people in the social sciences that advocate it. But Brooks Crenshaw, we've probably got one more question left before we each do our brilliant last
Can I make
word.
a quick comment on that one?
Of
Because
course.
again, I think it's way more insidious. I think if you are a liberal and you're a therapist, if a 4-year-old boy comes in and he's, you know, displaying symptoms of, you know, wanting to be Jane, right? I think if you're a liberal, you're going to kind of maybe give into that a little more than maybe a conservative therapist might be like, well, it might be normal, but, you know, and I think that's how we go down the road of having, you know, transitioning kids young, because therapists kind of give into it and massage it and encourage it, maybe not meaning to be malicious about it, but rather than just seeing it as a child and it's a natural part that they may have this confusion. So I think that is, and then I just wanted to make one other quick comment, because there was and this is an analogy, there's a superintendent that just got put before the legislature here in Arizona. And when they asked him, okay, are you going to basically stop doing DEI under the Trump, you know, orders? And he said, no. He said, no, in my district, we're not going to stop doing it because kids need it. And I do think that that blends over, like you can with even therapy, right? So if you're thinking of things that liberals just believe, it's going to blend into how they treat people, I think.
Sure. I just wonder if it's a monolith. Is it that 15 to 20% that I'm estimating, or is it all of them? I don't think it's all of
Of
them,
course,
but
it's not all of them, but I think it's
yeah.
probably more than the 15 to
So
20%.
I think
Personally, and I think Brooks is going to make a comment in a second, but I think personally you're probably both right. Like I find that when you have like a dinner party full of people that are in the social sciences or the law or whatever, 80% of them after a glass of wine will probably say, I think this is all stupid bullshit. And
Yeah.
hopefully the right will be able to come in with a good counterpoint and knock it out of the public square. But the 15% of people, which is probably about right, that really passionately believe this shit have been very good, better than the conservatives, at getting it into the law. So like in Illinois, where Chicago is, I don't think this is the case in Kentucky, but it's, as a therapist, you are supposed to strictly affirm little kids who say that they are transgender. So that's the problem. Like, are you going to violate what's technically a policy in the field in a major city by saying, look, you don't have to dislike the color pink to be a man, which again, I think all of the men on the panel would agree with. But Brooks, I don't know. It's a good tie color. I like it. But the point
I've
is,
got plenty of
though,
pink in
that
my wardrobe.
I've got a
your
great
polo
pink
shirt,
shirt. Yeah.
a lot can be done with pink.
Yeah.
Salmon, many colors. Some of them gauche, some of them beautiful. But the point, though, is just that I think if you're told not to say that, I don't know if I'd say it. And I'm pretty aggressive. Like, I think a lot of people would just say, I don't take cases of that kind or something like that.
Yeah. I
But
mean,
Brooks,
for me,
sorry to jump
go
in on
ahead,
that.
Brooks.
What
I'm
were you going
sorry.
to say, man? I don't want to
Well,
forget you.
so I think lurking in the background of this entire conversation, we've touched on it, I would say passively, is that people lean either consciously or subconsciously into incentive structures that, you know, they lean into their incentives. And I think, you know, Pat, you talked about that with the group of therapists that didn't know they were doing it, but were leaning into it because there's an incentive there. You know, and I was in Nashville at the time when the whole Vanderbilt thing went down with the underage, with the minors and the transgender stuff. And, you know, I certainly, I've been in multiple industries and I've seen how people lean into the decision-making is almost always aligned with incentives, whether the person making the decision really consciously understands it or not. That's a very powerful
Mm.
force. Do you think that is part of what's at play here? And we haven't really talked about the LGBTQ stuff that, you know,
Yeah.
you've got some of that featured in your content. What do you think is going on there with regard to mandatory affirmation, and what's your take on that?
Yeah, I mean, mandatory affirmation is a very interesting policy to me because mandating anything makes no sense from an evidence-based care perspective
Right.
because there, you know, in the world of psychotherapy, there are multiple evidence-based protocols for, like, let's just take depression as the easy example. So of the evidence supported and evidence-based treatments on the APA's Division 12 website, the clinical psych website, you'll find acceptance and commitment therapy and cognitive behavioral therapy and IPT, interpersonal therapy. At least those three interventions have great evidence to support the treatment of mild to moderate major depressive disorder. And I think REBT is there too. And so likewise, for young people struggling with gender dysphoria, you know, there's the affirmative model that's very popularized by like Pachankis and Safran, which I think is generally described in very broad terms, right? And so this is the thing that if I were practicing in a state where it was mandated, and I have worked with LGBT folks for years, you know, I used to run one of the only LGBT programs on the planet. It's called La Fuente here in Hollywood. It's a drug rehab just for LGBT folks, and work with a lot of trans people successfully, believe it or not. And I never once said you have to be trans or you have to start hormones or some like authoritarian nonsense like that. I always asked a lot of curious questions and simply tried to affirm where they're currently at, not where they're going to be, right? Because I don't know where anyone's going to be. Just like I don't know where my patient with depression is going to be in a month or 2 months or whatever. They might still be fairly hopeless or not hopeless. I don't know. But the idea of affirming, to me, the way I teach this at my university, is you are to not judge or make definitive statements about where the person's currently at, but just affirm what they're currently struggling with and what they're currently trying to understand and explore. So the idea is it okay to feel what you currently feel? Absolutely, 100%. No one in their right mind in the profession would be like, no, 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 you shouldn't experience gender dysphoria. You shouldn't be depressed. Like, who the fuck says you're not supposed to be depressed? Maybe you are supposed to be depressed. If you're having flashbacks because you have PTSD, that makes perfect sense.
Right.
If you hate your body, and that's one of your symptoms of gender dysphoria, okay, that's where you're currently at. And I don't have a judgment about that right now because that's where you're currently at. And there's nothing I can say or do right now that's going to change that. I'm no master of the universe. I'm no genius that can magically make your dysphoria disappear today. And because I'm not any of those magical things, I affirm that right now you feel all fucked up about your body. You might even hate yourself. And that's okay. I'm not in a rush to change anything about that right now because maybe you just need to feel okay right now. Now, is this how you want to feel forever? Follow-up question. Most people, no, of course not. So then the next question is, of the options of things we could try, what might help? So for instance, there's a curriculum that Pachankis and Safran recommend called Being Out with Strength, right? And basically it's a combination of CBT and other well-supported skills to help people at least feel more comfortable in their skin. So if you really are trans, can we do some of the CBT kind of work to help you feel more comfortable in your current situation? Which is different than saying, yes, I am this thing I know I will be in 10 years. If that makes sense, when I'm fully transitioned or whatever it is. It's more like, can I be okay with how I currently function? So if you're a more effeminate male, can we just be okay with that? Which is different than saying, yes, I'm a trans person who is going to have, you know, perfect tits and whatever it is. It's probably going to get me fired, but who cares? But like, generally speaking, the affirmative model is, there's an activist version of it, which I know is pushed. However, I've never had to do that to have good relationships with trans people and to treat them with respect and use evidence-based psychotherapy to help them feel okay now and be more self-accepting, which doesn't necessarily mean I know what you're going to look like in 10 years or 6 months. You know, I've never kept someone from transitioning. I've never tried to talk them out of it. I've never done anything coercive because I believe they're not trans or some shit like that. I've always just tried to treat them with respect right now and affirm what they're currently going through. And whether or not this is how they will be in 6 months is not up to me, and I'm not invested in that.
Have you dealt with trans kids, and how do you or how have you handled those that think that they want to transition, especially at a young age?
I've only worked with people 18 and above so far. I've worked with a lot of 18 to 24-year-olds who are either pre-transition or only on hormones. And so, which is a type of transition. So I've worked with a lot of people, and some of the people that I've worked with who are 18 to 20 something stayed on hormones but didn't do any surgery. Some of them went forward and had surgery, and some of them stopped hormones. And so, like, I got different results with different people because that's actually what the literature says. Different people have different trajectories. Not everyone does hormones and everyone does surgery. So I haven't had any experience with younger adolescents at this point.
So a follow on there is the comparison to anorexia and cutting, particularly in adolescent girls, but in general, is that proper, and why or why not?
I think that that is a really great tactic. And it really catches because it's so superficially similar that you can't help but think it's true. And I think the problem is it assumes trans people are a monolith. And as a clinician, no two depressions are alike, no two gender dysphorias are alike, right? So some people have genuine persistent gender dysphoria that would be likely helped by, at some point, some kind of interventions, right? Especially as an adult, your free choice, do whatever you want to do, right? So for me, I would say, which bucket of kids with gender dysphoria are you comparing it to? Are you comparing it to the kids who have 3 or 4 co-occurring disorders and maybe their gender dysphoria is not the main focus? Or are you comparing it to the kids who have pervasive, persistent since I was 3, kind of difficulties in their body? Because I think if you're comparing it to the group of people, and this is just 2 groups, there's probably 4 or 5 subgroups of people, but like, if you're comparing it to that group of people who's wildly mentally ill with 5 or 6 different conditions, I know wildly is going to get me fired too, but like the people who have multiple co-occurring conditions, to be precise about it, I can understand that comparison. But comparing it to the kids who actually have gender dysphoria, who probably are better off different, I would say that's not fair at all. And it's probably meant to just put them in the group of the other group. And I don't like that.
Okay. I think that's very fair as the medical professional. Another response, though, in terms of Brooks's point would be, I think people make that comparison, having talked about it at events and so on, because there are obviously people that are genuinely anorexic as well, that are going to deal with anorexia nervosa. I mean, I've been in relationships with people like this, or bulimia, for quite a period of time. And I think no one would really use that as a rationale for telling them to get as skinny as possible. And with modern vitamins and so on, it would be possible to do that and not really harm yourself very much. I think that at some level, most people, and this is a layman's terms, obviously, but most people would say, no, you're crazy. You actually need to stop not eating if you want normal relationships, if you want normal health at 50. Would you disagree that there are, in a huge chunk of cases, that's the exact same thing with gender dysphoria? If you cut off your penis at the most extreme at 18, there seems to be a lot of statistical data saying that you'll probably regret cutting off your penis. So do you feel that we should treat that differently? This is a very different sort of condition?
I can't speak specifically to what the percentages are in each bucket of people, right? So it's such a rare, small group of people. It's like less than 1% of the population. And so the idea that I can say with certainty the split is 50-50 or 70-30, like, I bet it varies a lot. And so my hope would be that the people who are making these choices are making the most informed possible choice. So that's what informed consent is all about. And so for the people that an analogy or comparison applies to, I'm sure informed consent is not happening appropriately. Right? Because most people are afraid that they'll get canceled for saying things like I've said here. Right? Where in reality, I just want people to get the best possible outcome, and I don't know what that is because I can't know. So all I can do is ask questions.
Last question, because this fascinates me. When you see, and generally it tends to be, you know, Caucasian women or a lot of celebrities letting their little 4-year-old or 3-year-old sons in dresses, right? What do you think on just like, not even take off your doctor hat, just on a personal level?
Or apply it to the mom. Maybe.
Like,
Yeah,
what do you think? Especially in California. I mean, I lived in California,
Yeah,
so.
yeah.
In
I mean,
Hollywood,
listen,
I know you see it.
for sure. I mean, like, my hope is if you're a freak, then be a freak. I think you should be whatever the fuck you want to be.
You mean
So
the
if you're-
parent? Because I'm talking about a little 4-year-old child.
Yeah, the problem comes in if you're in the Munchausen mommy zone, you're still doing a little bit of blow occasionally. You got 3 kids that you adopted from Eritrea, and they all of a sudden all are girls. I think like mom can do whatever she wants. People are into sexual kink, partying, so on. That's not bad. No,
Yeah.
I mean, some of you guys might disagree with that, but anyway, whatever. It's Christy Kelly, a lady's never even considered the question. But the point is, if you want to do that as a successful actress, that's fine. It may be good in some ways for the people in your life. If you want your kid to do that, and I think this would apply to any of these things, like explicit photo shoots, taking on adult gender and sexual identities, I think most people would pretty strongly oppose that.
Yeah, for me, I don't want people to harm their kids. And so I would need to know more about each situation, obviously. So if the parent is forcing the kid to wear a dress or coercing them to wear a dress by trying to convince them of something, then that's stupid. Because you shouldn't try to convince your kid of anything. If you're a good parent and you're living a good life, my belief, and this is probably the worst thing I'll say here, is if you're doing your job fucking right, you shouldn't have to convince your kids of anything because you're living according to principles and you're a stand-up person who's transparent and your behavior is congruent with the fucking stuff you say. But if you're a nut job or if you're a coward, you're probably going to have to convince your kids, you know? And so I hope that no parent has to convince their kids. I hope that every parent that's doing their best would never try to convince their kids to look like something or sound like something. You know, let kids be creative. If they're creative, wear a dress. Who fucking cares? If they're metal, be metal. If you're a goth, be a goth. It won't last very long for most kids. That's usually a pretty good sign that everything's okay because they'll predictably shift from thing to thing to thing and figure it out at some point. So like, I would just need to know about the particular celebrity and, you know, because if it's like you're going to force your kids, that's stupid. Don't force your kids to do shit. Force them to like eat good and like sleep and like make friends and play. Don't force them to wear certain things. Who cares? That's
all right, that's a beautiful ending. There's a great line in there as well. If you're a good dad or mother, you shouldn't spend a lot of time convincing your kids to do shit. They're either going to obey orders or what you say is going to sound logical. That's a forgotten point about parenting. You shouldn't be holding dresses up in front of your boy and telling him to put them on. If he does wear a dress, how you handle that's up to you. I'll give my solutions offline. But let's close with the last statement from the panel. As always, Christy Kelly, you've had some strong opinions on this. What's your last statement?
Nope, I'm going to defer to you guys because I feel like I talked a lot. But it was a pleasure, and you have restored my hope in at least this particular California psychologist.
Oh, awesome.
Hopefully many of our guests do that. Oh, stepped right on that like an asshole, but hopefully many of our guests do that across policemen, soldiers, artists. We'd bring them on for friendly conversations, but I'll go next because I want to hear Brooks's point and then Pat's. But I think it's important just to realize that people are people. Some other adult upper middle class citizen, because I think that describes all of the panel pretty well, knows their field better than you, but doesn't have any magical genius-like abilities that you do not have. So when the doctor tells you to do something that's going to radically change your entire lifestyle, maybe talk to a second doc. The lawyer says that's going to be $5,000. Can you work it out by having a yelling match over the fence? You know, and it's the same thing with this. Do you really need more than 2 sessions of treatment? That's up to you because you're a person and you're not an idiot. Okay, Brooks Crenshaw, what's your take?
Well, so I think one of the key points that Pat brought up, and I tend to agree with that, is that we've somewhat abdicated voluntary community. And when that happens, inevitably the state gains a lot of that. You know, the notion that when you abdicate responsibility, it's usually taken over by a tyrant. And whether it's, you know, the cops have to come or, you know, the social services or what have you, but like this is, I think, a key problem that affects both voluntary communities and the electorate at large. And I think those are two big problems. And I tend to agree with you. I'm glad to see you're an Eagle Scout. I know that structure and that community was probably very good for you. The military was good for me in that same respect. A lot of young men get it through sports, etc. But the abdication of voluntary community, I think, is going to be potentially our downfall, and that's why I live in a farmhouse in a rural area where I know all my neighbors and we get together.
Oh, beautiful! And Dr. Lockwood, what's your final note here?
I mean, thanks for having me, obviously, and I don't know. I mean, like you said, people are people. People are complicated. The story is always more complicated than what you see on social media, you know? And I think seeing more of the nuances and complexity of these things is what I want everyone to understand. Because yeah, it's easy to talk about people as a monolith or all types of mental illnesses as similar when they're not. And I think when you really understand people and have just a basic amount of compassion, there's probably a lot more going on than we know. And I think the political has corrupted our brains to jump to quick conclusions about how complicated it is. And I just think that does all of us a disservice because it makes us treat each other with disrespect that's not necessary. And finally, I think, you know, life is really short. You know, why do you care about this shit is always a question I ask people. And could you be spending more time with your family and your friends and taking good care of people right here in front of you, as opposed to arguing online or some shit like that? Because, like, you know, life is so good. I'm a very blessed person in some ways I didn't even earn. So I just, you know, shout out to good luck and taking good care of the people in front of you, because that matters most.
Oh, beautiful ending.
I got a country to say. Patriot J, I'm saving the day. Patriot J, I'm saving the day from you commies who lame. No, you can't fuck with me. I got a country to say. God bless the US of A. Land of the free and a home of the brave. God get all of the praise. I got a country to say, because I'm Patriot J and I'm saving the day.